Thank you for tuning in to today's update. Now, I've got a brief report from Canada first of all, then we've got concerning data from the United Kingdom and the United States, concerning in slightly different ways. I want to look at those in a bit of detail today, and then we'll remind ourselves of the ongoing situation in Brazil and the escalating situation in India. But I want to start off today by looking at the story from Canada in the Canadian press. Now, this was interesting because there was 1,600 military personnel deployed to long-term care facilities in Quebec and Ontario. Firstly, quite an indictment really that the military needed to be called into this situation, and yet that's what happened. Some care facilities, at least one I heard on the news, had been abandoned by its staff, which is quite unbelievable, but that's what happened, and they were certainly massively struggling for staff. Now, it turns out that of the soldiers and other military personnel deployed to the care homes, 40% of those deployed had contracted coronavirus in their billets, and they'd been billeted to hotels where they were sharing space with other emergency workers, and of course other emergency workers, nurses, paramedics, doctors, are at higher risk, and yet they'd been sharing hotel accommodation with these people. Somewhat of an oversight, you might suggest. And I think it's fair to assume that in these hotels there would be a certain amount of socialising going on and opportunities for the virus to spread, because the military were only testing people that were symptomatic. So the people that went to work in these care facilities, if they woke up in the morning and said, "Yeah, I'm feeling fine, Sergeant," then they just said, "Off you go, lad." They weren't tested if they were asymptomatic. They were only testing symptomatics. So a bit of a mistake there. So the question is, by not testing asymptomatic military personnel, how many more cases were caused in these care facilities? Now, we don't have the answer to that, but I think it's reasonable to assume the answer is quite a few. Now, this is interesting as well. Of the military themselves, remember 1,600 military personnel deployed to care facilities. So out of those 1,600, 55 soldiers were believed to have contracted the virus from care homes. So that was the estimate of the medical authorities once they reviewed this situation. Now, given that they've had 1,600 soldiers in what is really a quite high-risk environment, for 55 to contract it is actually a relatively low number, indicating that good personal protective equipment precautions were usually taken. Now, of the 1,600, 55 contracted the virus in the care facilities. 4 are still ill at the moment. So that means 51 have made a good recovery. And to some extent you would expect this, because military personnel are obviously young and fit. Thankfully, none of the military personnel were hospitalised. That's good news. So none of them got seriously ill, and it looks like these 4 are on the way to recovery as well. We wish them a speedy recovery, and it's looking hopeful for them. And the military are now being tested before and after care home deployment. Now, having said that, the Canadian Red Cross is somewhat stepping up to the plate and taking over this role now. But any new military personnel are tested before they go to make sure they are not transmitting the virus to people in the care facility. And they're being tested afterwards in case they contracted the virus in the care facility, to prevent further community spread and to prevent spread to their family. So definitely a bit of ball dropping there from the Canadian authorities and the Canadian military authorities. But the ball has been well and truly picked up now. So lesson learnt from this pandemic, one of many lessons being learnt from this pandemic. Now, the United Kingdom. Now, I don't follow this. There's been some sporting event or something in Liverpool, and there's been 2 nights of parties. And I must say I've been quite appalled by the scenes I've seen on television. So if you are in these party groups in Liverpool, consider the reckless behaviour that you've taken, and the other people's lives you've put in danger, and indeed your own life to some extent. So if you've been taking part in these celebrations in Liverpool over this sporting event, then what I would suggest that you do is self-isolate for 14 days. It's the same advice I gave to the people from the recent political protests. If you've been to these protests, if you've been to a mass gathering, you need to self-isolate for 14 days. Your behaviour is irresponsible enough as it is. Don't compound that by further irresponsibility, by failing to self-quarantine with your families for 14 days. It's just ridiculous having parties like this, ignoring social distancing from the video I saw just because of some sporting event. Unacceptable. Self-isolate for 14 days. If it turns out you haven't got the virus, I'm glad you got away with it. New daily cases in the UK, according to the COVID Symptom Tracker app, 2,341. And this in the notes works as a hyperlink. The latest COVID Symptom Study app data suggests that the number of daily new cases of COVID-19 over the past 2 weeks has begun to stabilise. Now, what this is saying is that we have enjoyed a very good reduction in the UK of the number of new cases. It's come down really quite nicely. No thanks to these protesters and people in Liverpool, I might add. I'm still quite annoyed about that, as you can probably guess. Sorry, I'll get over it. You know, but seriously, when you consider the effort that I've been to personally, not visiting my sick father, and many people have had relatives die, and they've been unable to attend them to stop the spread of this virus, and then people have a all-night drinking party because of some sporting event. Completely unacceptable. The price has been paid as high, and to see people squandering that is really quite disturbing. Anyway, what was I saying? Oh yeah, so the number of cases has been coming down nicely, but that decline is not as steep now. It's almost levelled off. Not quite levelled off. It's still going down, but it's not going down anything like as quickly as it was. So the relaxation that we've seen in the lockdown measures in the UK is already feeding through to more cases. Not that the number of cases is going up, but the rate of decline has greatly shallowed. And what I would expect, especially as the 4th of July and the UK Independence Day comes closer, I would expect that number to level off. Then I would expect it to start increasing slightly. I think that's really quite inevitable. So the early data on that is coming through already. And it's not surprising. I'm not saying there's an alternative to this, but it is what the epidemiology unfortunately dictates. So for the past months, the number of new daily cases have been falling week on week, and this is the first time the data has stopped falling. It's nearly levelled out now, as we would expect because of the removal of restrictions and the fact that the virus is still endemic in the community and there is still ongoing community spread. So that takes us on to the R number in the UK, the growth rate. The R number ranges in the UK from 0.7 to 0.9, so it's still going down, and it's probably about -3% per day. So still a very nice reduction there, but recently this was 5% a day, 6% per day, 7% per day. It's now down. It's levelling off. And the government now are actually printing, this is quite interesting, let me just get me out of the way. They're actually putting data forward now about the R values in different parts of England. So London, for example, we can see that the rate of decline is between 6 and 0% per day. Now, of course, that's the decline rate. And of course, there's fairly big variables around this. It's hard to be certain about this number. And the R value in London now is 0.7 to 0.9, whereas of course it was well over 1 before. So we see in the UK now the northwest, in the northwest of the UK, the R value could be as high as 1. And in the southeast it could be 0.9, 0.9. So there's this degree of uncertainty. So overall, it's looking like the R value in the UK is around 0.8 overall, 0.7, 0.8, 0.9. Hard to be more accurate than that. And even though we've got negative numbers here, even though the number of new cases are going down, virtually everywhere, although as we see in some areas it could be naught. There could be no decline. On the whole, it looks like it's still going down, but that rate of decline has greatly reduced. We are not declining as quickly as we were a week or two ago. Now, moving on to the United States, it has to be said even more concerning. Let me just show you a graphic here. So this is the cases in the United States. So we know we had a lot here. We had a fair bit of decline, and recently from the 14th of June, we've had a fairly sharp increase in cases in the United States, looking at the order of 35 to 40,000 new cases per day. Now this is interesting from the States. Cases by age, this is all CDC data. Following chart shows the ages of people with COVID-19. And if you go to the website there, which will give you a link, you can hover and do some clever things on there as well. So data were collected from over 2 million people. And the ages were available for virtually everyone. And what we see is the people testing positive are mostly in this young adult age group. So a lot of people in the young adult age group testing positive. Now, why is it? This is an interesting question. Why is it we have more young people testing positive than older people testing positive? If I can just show you this. There we go. So these are the age groups here. We see more younger people here testing positive than older people. Well, I think the answer is that most of the older people are self-isolating themselves much more, whereas the younger people, especially young adults here, are going out partly to work, partly to socialise, but that's caused an increase in prevalence in this age group. Now, thankfully, the case fatality rate in this age group is very low, but of course these people who are 18 to 44 have got parents and they've got grandparents who they are reasonably likely to infect if they come into contact with them. So basically the younger generations in America need to be having minimal contact with the older generations, because it's the younger generations that have a higher prevalence of the virus based on this testing from the Centre for Disease Control, and as we say, based on large numbers, so likely to be accurate, I would think. So lots of data here from the States for you to check on. Now I'm going to highlight some CDC new data here because I think it tells us something fairly fundamental about the nature of this virus. Now, to be fair, this data is based on somewhat old statistics up to I think about the start of May, but it's still based on quite a lot of cases, so it tells us some things about this virus that are reasonably fundamental, I think. Now, the transmission occurring prior to symptom onset. So this is what drives the transmission. What is driving transmission here? Well, 40% of cases, 40% of people that get the virus contract the virus from someone who was asymptomatic at the time. So pre-symptomatics and asymptomatics are responsible for 40% of new cases. That's your transmission driver. So quite a large number. So this just shows the importance, especially if you've been in contact. For example, if you've been at a demonstration, if you've been at a party, if you've been drinking in a crowded bar, then you're at reasonable high risk, and these cases are responsible for 40% of new transmissions. So of all the people that get the virus, 40% got it from someone who at the time was feeling fine. Time to exposure of symptoms onset, the mean is 6 days. Now we're still staying 2 to 14 days, but the mean, the average value is 6 days. That's the mean value. So it could be 4, 5, 6 days, it could be 6, 7, 8, 9 days. Round about that would cover most of cases, but it can be as little as 2, it can be as much as 14. 2 would be unusual, 14 would be unusual, 6 days is the average. Now, mean number of days from symptom onset to hospitalization. This was interesting. So this is looking at, let me just take me out of the way a minute. So mean days of symptoms. So from when people first get the symptoms to when they're hospitalised for the people that do go into hospital. And it's slightly different for these three age groups, 0 to 49 years, 50 to 64 years of age, over 65. Slightly different, but not a lot different. And we're looking at basically round about a week from people first getting symptoms. And for those that are sick enough to need to go to hospital, it's taken about a week for them to get sick enough to need to go to hospital. This is less than the initial data was showing. We had thought that people were getting iller in the second week, but this is saying no, most people who need to go to hospital have had symptoms for about a week. Percentage of those admitted to ITUs of those that are hospitalised. So if people are ill enough to be hospitalised, what percentage of those that are already hospitalised end up going to intensive care? And again, we see some difference over the years, but not probably a significant difference. So what we're seeing is round about a quarter, just over a quarter here, just under a quarter there, just over a quarter there, of people who are sick enough to go into hospital get sicker. So if people are sick enough to get into hospital, if they're sick enough to indicate going to hospital, there's a reasonable chance, about a 25% chance, they're going to get even sicker. Interesting data from the CDC. Based on large numbers of studies, this has to be said. Not that one, we'll see you in a minute. Mean number of days from symptom onset to death. Now, this is interesting as well. Very serious. Mean number of days from symptom onset to death, from when symptoms begin to when people die. Again, slight differences in the age groups, but not massively. And the answer is basically around about 2 weeks. So if people are going to die, for the people that die of COVID-19, for most of them, it's taking about 2 weeks to die. Now, of course, some it's less, some it's more. These are average figures. But from onset of symptoms to death, typically for those that are going to die, 2 weeks. So interesting data there from the Centre for Disease Control. Now, going on to the United States itself, the situation is, of course, well, it's getting out of hand, to be quite honest. New cases over the past 24 hours. Now, I got this from American News this morning, and it's a very high figure. 17,000 new cases in Texas, 14,000, nearly 15,000 in California. Florida, 13,000 new cases. Remember, these are new cases in a 24-hour period. New cases in one 24-hour period. Arizona and Georgia. And I don't think North and South Carolina are far behind either. So we see that in the worst way possible at the moment, Texas is leading the pack. So let's look at the data from Texas in a little more detail. Texas cases are now up to 137,000. Well over 2,000 deaths. Good to see the recovery numbers published by Texas. Not everyone publishes this, so that's good to see. But of course, if we look at 74,000 recoveries and 2,323 deaths, I can't quite do the maths quickly in my head, but it's like 60, 70,000, isn't it? People still have the condition at the moment. What is it, 65,000 or something? So if we take that and that away from that, that gives us the people who still have the disease at the moment. So a lot of people still have the disease in Texas at the moment. And of course, as well as that, there's going to be many other pre-symptomatic and asymptomatic people watching in Texas. So if you're watching in Texas or one of those other states that I've just mentioned, it would be reasonable to assume that you could well be infected at the moment and therefore, if at all possible, should self-isolate. The testing rate to get this data is 5.72% in Texas. So to test 5.72% of the population of Texas is some feat, but it still means there's big unknowns. But what we do know is it's been 15 or 16 days now of increasing records of hospitalizations. So hospitalizations are dramatically increasing in Texas. Surveys show that 12% of the population is testing positive. So of these tests here, about 12% are positive. So it's looking like about 12% of people from population surveys Looks like about 12% of the population of Texas currently have the virus. Now, if that's correct, that means if you're watching in Texas, there's over a 1 in 10 chance you currently have the virus. So for those kind of odds, to me, it's well worth isolating if possible. Now, bars have been identified by the epidemiologists in Texas as transmission drivers. So many people have contracted this COVID-19 virus while drinking in bars. The social proximity of bars has been a major transmission driver. So they're being ordered to close, I believe, all over the state, which of course is good. Still open for takeaways, but I suppose the point of going to a bar is to drink and to socialise. And if you take away the socialising aspect, you might as well just drink at home, I suppose. But anyway, that's what's happening. Restaurants were allowed to open at 75% capacity. That's gone down to 50% capacity. Outdoor gatherings limited to 100 people. Still quite a lot, of course. Masks orders in many places. So some cities and regions have mandated masks, others have not. Now, Houston, I don't know if it's all of the intensive cares in Houston or just 1 or 2 of them, but there's certainly reports of ITUs in Houston being at 100% capacity. And there is a field hospital option. It's not being taken up yet, but there's a field hospital option. Let's hope it's not required. And Linda, I don't know how to pronounce your name, madam, I'm sorry, but I know you are one of the High Court judges or circuit judges. Linda Hidegalo has implored people to stay at home because she doesn't want to open field hospitals. So I would agree with that. And if you think that if you're living in Texas, according to the data I've just read out, there's more than a 10% chance you're infected now, that indicates that that's appropriate. Now, Dr. Doug Lawson, a senior doctor who runs hospitals in Houston and the area, has identified the reasons for the high infection rate in Texas. Has he identified some amazing new factor in Texas, some incredible thing that people never knew about before? Has he done some clever epidemiology to work out what's actually going on? Well, yeah, he has done some clever epidemiology. Poor mask discipline, poor hand hygiene, poor physical distancing. Could it get any simpler? Have we not been going on and on about this since January? The answer is yes, we have. But this is what he identifies as the drivers of transmission. So we now bring on, at the appropriate time, Zelda and her friend in London. Now, they're wearing some eye protection here, which is good. I think that's good. They've obviously got masks on to protect themselves and primarily to protect others in case they are infected. And the other thing I liked about this photo, there was nurses and doctors in China way back in February shaving their heads because in China, hair was, I was going to say hair, I don't have much to illustrate, but you can probably just see that. Hair is used, has been a vector of transmission. So the virus has been transmitted on hair. So I'm glad to see that these ladies have got their hair. There's a bit there straggling out, but basically they've got their hair tucked away inside the caps or wearing short hair. So that was good. That was good, I thought. So nothing earth-shattering there identified by Dr. Lawson. Things we've known about for ages. Get the basics right. Even in my country now, you go to the supermarket and most people aren't wearing masks because they're not mandated. Now on public transport they are mandated. Why on earth are we spending billions and billions and billions of pounds on social lockdowns when we could massively reduce the transmission by just saying, right, everyone wears a mask before they go to the supermarket? It costs nothing. Why aren't we doing that? This is one of the deep and profound mysteries of the universe. Why are we still ignoring obvious, simple, massively cost-effective strategies to greatly reduce transmission? I can't work it out. Why aren't we doing that? We're doing it on public transport, but not in other public places. But the epidemiology is now clear. We should be doing that. And Dr. Larson is saying poor mask discipline, poor hand hygiene, poor physical distancing. Well, imagine that, eh? Really, really, really simple stuff. And things are so bad in Texas that people are being brought in from other states now, which of course is it's encouraging to see that people are happy to do that, but sad that it's necessary. Now, I've been showing you lots of pictures from you good people recently. I'm going to show you some from mine. This is a few years ago, but this was some of my... these people were happy to be shown, by the way, before I just show you the picture. These are some of my wonderful students in Cambodia. They worked really hard. I mean, I'm not saying they weren't boisterous, but they were really good students. And the level of English was varied, but this guy here, his English was really quite superb. So when I got stuck, he would translate things for me. So quite a privilege to teach these wonderful young people in Cambodia. I actually worked with Cambodian refugees back in the early 80s during the Vietnamese occupation. So to go back to a liberated Cambodia is still quite a thrill for me, I must say. So that's Life University in Sihanoukville, first class university run mostly by Korean missionaries. Yeah, they were a great class. Oh, now this is a crocodile that came onto the campus and had to be escorted to new premises. I did see him in his new premises. They were very nice, so he wasn't harmed. But having worked for 27 years in educational institutes in the UK, I'd never seen a crocodile escorted off the premises before. Now these students at weekends, they're incredible. They go out to the villages. So this was a poorer village, probably about 20-30 miles out from Sihanoukville, and they do like clinics and give health education advice to the local villagers. So this gentleman here, for example, has come for advice, and the students were talking to him and giving him health advice. So quite an excellent outreach strategy, and there were still students at this stage. So when they're all clever, qualified nurses and doctors and things, I'm sure they'll be doing all sorts of amazing work in their own country. Truly inspiring to work with young people of such calibre. This was the hospital in Phnom Penh during the ward rounds. I got in the way. Very competent medical staff in charge, doing an excellent job. That's actually called Sihanouk Hope Hospital in Phnom Penh. Now these were the nurses on the ward, and we gave all the nurses a copy. So that's my black book, Campbell's Pathophysiology Notes, and that's my white book, Campbell's Physiology Notes. So what we did was we got these printed up. We had the PDF, so we got them printed up. There was a printer around the corner, printed them up. So we actually gave all the nurses in the hospital a book. They only cost about $4 each or something. So really good value. And then, I mean, these books are they're fairly basic. They're for student nurses and junior medical students, really. That tells you all the kind of physiology you need to know, and that tells you all the basic pathophysiology. It's what everyone needs to know. And then all the doctors went in the strop because they weren't given one. So we had to give one to all the doctors as well. So we ended up giving these books to pretty well everyone in the hospital. It was a privilege to do so. Now the great thing about working in Cambodia is lunch is taken really seriously. Now my last job in local A&E department, lunch consisted of stuffing a sandwich down your throat as quickly as you could and then getting back to work. But the Khmers work out their day to fit in a good lunch, and it was quite excellent.